Hello, this is Dr. David Greene, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is the basics of disc bulges and disc herniations. First, let's look at the normal intervertebral disc. Now, you have a disc at every level of the spine, and the normal disc is comprised of 80% water and 20% proteins and collagen. There are two areas of the intervertebral disc, and this is a view looking down on the disc. The outer layer is called the annulus fibrosus, okay, and that does have nerve endings and it can feel pain. The inner gelatinous layer is called the nucleus pulposus. It actually does not feel any pain. There's no nerves at all. The disc acts as a shock absorber, so as you run or walk, load is placed on the spine and the discs lose water as shock is taken in, and then the water comes back in, many times every day. Now, what happens when discs start to degenerate? Well, it typically occurs between the ages of 20s to 50s, and there are some risk factors that have been identified, including obesity, smoking, repetitive trauma, like an occupation, like maybe a truck driver where you have, repetitive micro motion. But then there's also some genetics and some environmental factors as well. Okay. Now, what can happen? Well, this can lead to loss of fluid in your discs. Normally, you have 80%, water, and that can start to decrease. You can start to lose height because you don't have the water coming back in, and then this can lead to tiny tears or cracks in the outer layer, the annulus. So here you have a healthy disc in this cartoon, then you have two layers of compressed discs, and then it gets back to being a little healthy again. So when you see this on an MRI, this is looking at your spine from the side. So this is what a normal disc looks like. Kind of a whitish appearance, and that's from water. And you have another one. And then say you have a darker disc here, and you actually have a disc bulge. Okay? Now a disc bulge occurs as you lose water in the disc. It's almost like a tire losing air. The result is that you lose height and the disc bulges out. Okay, so there's less air in the tire, so to speak, less water, and the discs start to bulge as it loses height. Now, there have been studies looking at this. 35% of those between the ages of 20 and 40 have disc bulges and what's called degenerative disc disease, and no back pain whatsoever. Okay, so it's important to understand that just because you see this on somebody's MRI might mean they don't have any pain. Okay, or it might mean that they have excruciating daily pain. The two don't always correlate. Now, disc herniation is on the same timeline, but it actually goes a little bit farther. So if a tear occurs in the outer layer, which is the annulus, it may cause a lot of back pain because, as mentioned, there are some nerve endings in this layer, okay? Or it may cause no symptoms at all. Now, if the tear is large enough, then you can see it here. Some of the disc material may squeeze out from the inside, almost like the jelly squeezing out of a donut. Okay. Now, this is called a slip disc in layman's terms, a herniated disc, a herniated nucleus pulposus, prolapsed intervertebral disc, herniated intervertebral disc. All these terms mean the same thing. Okay. And you can see the continuum here. You have a normal disc, then you have a disc bulge. As we mentioned, some of the air comes out of the tire, you get some degeneration of the disc and it starts to bulge. Then if the actual tear occurs, some of this can come all the way out. Okay, so that's what we're talking about. Well, what kind of symptoms result from a disc bulge and a herniation? Well, as mentioned, most disc bulges don't cause any pain. Okay, so or they may end up with some back pain. Sciatica pain can lead to inflammation of the outer layer of the annulus, and that can lead to inflammation in the area around that if there's a nerve root kind of moving on by, and you can have spasms and aching. So just having a disc bulge and a degeneration of the disc can lead to both back pain and potentially sciatica. Now, if you actually have a herniation of the disc, as I just showed you on the previous slide, that can lead to burning, searing pain down a leg, pins and needles and numbness, even motor weakness, like you might have trouble lifting up your foot, okay? And rarely incontinence can result. So what's the treatment for a disc bulge or a herniation that is symptomatic. If there's no symptoms, you don't need treatment, okay? Now, benign neglect is where basically you know that the person has an issue, but it's not bad enough to actually need treatment. You just kind of watch it. If it gets worse, then you treat it. So over-the-counter medications, if the pain is moderate, such as anti-inflammatories and Tylenol. Physical therapy can be very helpful to help relieve the symptoms, help strengthen up the muscles around the back, relieve some of the pain from the pinched nerve. Chiropractic can do a lot of the same things. Spinal decompression therapy is a revolutionary treatment that involves intermittent spinal traction and has over an 85% success rate with the pain coming from disc bulges and herniations. And that pain relief can last for months at a time. Prescription medications for this pain may include such things as a Medrol dose pack, which is written as a prescription. It's a 5-day burst of steroids, such as prednisone, that then tapers off over the last few days. You should only use that sparingly because it can have other side effects, but it can be very effective. Now, narcotic medications or pain medications like tramadol can be very effective in the short term for sciatica-type pain. These should not be used long term because the risks start to outweigh the benefits. Muscle relaxers such as Valium can be very helpful because, as mentioned, some of the symptoms could include spasms. Neuropathic medications would include Neurontin and Lyrica, and these can be great for helping with the nerve pain. And then topicals. These may include a lidocaine patch, which needs to be replaced every day, or gels or creams such as Voltaren now comes in a cream form for the back. Interventional treatments for disc bulges and herniations that are symptomatic. If a patient is having spasms in the back and pain, a trigger point injection or a series of trigger point injections can be very helpful for relieving this and sort of knocking this down. There have been some studies looking at intradiscal injections, such as steroid injections into the disc for a bulging disc that's with a degenerative disc, and this has been shown that can be very effective. This was in a 2004 study out of the journal Spine. Epidural injections, as you see in this picture here, involve an outpatient low-risk procedure where under fluoroscopic guidance, which is a real-time form of X-ray, the needle is put in right near the area where the nerve root is being pinched, and this area is bathed with steroid medication, which is also called cortisone. And this does not fix the problem. It doesn't make this herniated disc go away, but it can provide weeks to months of pain relief and give the body time so that this can be disintegrated on its own. Okay, so it's a nice proverbial Band-Aid. And there are multiple different types of epidural injections, but they're usually given as a series of 3 over a course of about 6 weeks, and this could be repeated every few months. What are the outcomes of disc bulges and herniations? Well, studies show that over 3/4 of individuals who have disc bulges with degenerative disc and associated symptoms are able to avoid the need for surgery and achieve a nice level of baseline pain that's tolerable. And out of those who have sciatica symptoms due to a pinched nerve or irritation coming from an annular tear, over 95% are able to avoid the need for surgery. There was actually a study looking at this in the Journal of the American Medical Association, looking at the outcomes of disc herniations at 1 year with those who avoided surgery and those who had surgery, and the outcomes were no different. The best pain management clinics in Arizona are Arizona Pain Specialists. There are board-certified, award-winning pain management doctors. There's also chiropractors, acupuncturists, physical therapy, offering both medical and interventional pain treatments at 5 clinic locations. Over 50 insurance plans are accepted, and over 25 treatment options are provided. So call today for scheduling at 602-507-6550 and visit us on the web at ArizonaPainNetwork.com. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.